Hello, today's video is a bit different from the usual EDS content because this week is National Radiologic Technology Week. If you're new here, welcome. My name is Laura, and I make educational videos about hypermobile Ehlers-Danlos syndrome, as well as lifestyle videos where I share tips that make living with a chronic illness a little bit easier. So if that's something that you're interested in, please consider subscribing to my channel. Now, in honor of National Radiologic Technology Week, today I'm going to share with you some interesting facts about the profession, as well as some things that we wish patients knew about us in imaging exams. If you haven't already guessed, I'm a radiologic technologist, or RadTech for short, and I'm trained in 6 different imaging modalities: X-ray, CT, nuclear medicine, ultrasound, mammography, and bone densitometry. Radiology and radiologic technology are umbrella terms that encompass multiple medical imaging modalities, and the word modality refers to a specific imaging specialty like mammography, for example. So first, let's talk about some radiology facts that I think you might find interesting. On November 8, 1895, a German physicist named Wilhelm Röntgen discovered X-rays. The first X-ray image ever taken was of Wilhelm's wife, Anna Ludwig's hand. The first portable X-ray machine was invented by Marie Curie, a Polish-French physicist and chemist, most famous for her discovery of radium and polonium. Her portable X-ray machine was used on the battlefield during World War I. According to the American Registry of Radiologic Technologists, RadTechs make up the 3rd largest group of healthcare professionals in the United States, the 2 largest being physicians and nurses. Becoming an X-ray technologist, also known as a radiographer, is often, but not always, how many techs start their careers, and is needed before learning certain secondary modalities such as CT and mammography. Some modalities you can learn without becoming an X-ray tech first, such as ultrasound and nuclear medicine. In the US, you can become an X-ray tech in as little as 2 years, though some schools do have 4-year programs to allow you to earn a bachelor's degree. The additional imaging modalities will add time onto that training, whether it's through formal programs or just on-the-job training. There are a handful of states that do not require board certification or licensure to become an X-ray tech, and you can therefore finish training in considerably less time. With that lower level of education, you would usually be considered an X-ray technician instead of a technologist. The upside of being an X-ray technician would be that you would be able to start working immediately after high school and would simply receive on-the-job training, therefore saving a lot of money by not having to pay to enroll in a formal radiography program. The downside is the pay would be lower, you couldn't work that job in most other states without getting certified, and many employers still require certification even if the state does not. Now let's talk about some of the things us techs wish our patients knew about us and imaging exams. If you have EDS, you probably know most of these since you've probably had a lot of imaging done. I think the biggest thing is that we as techs cannot give you the results of your imaging studies. Since we're not doctors or any type of advanced practitioner, we're not allowed to interpret images and give medical advice in any official capacity. We can potentially lose our jobs or our licenses by doing so. Sure, we might be able to tell if a bone is broken or if your X-ray shows that you have pneumonia, and we'll often actually tell that to your doctor, but we aren't allowed to tell you. Typically, how it works is your exam is read by a radiologist, which is a doctor who specializes in imaging. Those results are then given to whichever provider ordered your exam, and that provider then tells you the results of your exam. There are a few exceptions to this rule. For example, we're usually allowed to tell you the gender of your baby during an ultrasound, and we can tell you results of any exam if a doctor asks us to tell you, since we're then just relaying a message. Next, a fractured bone and a broken bone are the same exact thing. Also, when we're doing an X-ray exam, we can't use a lead shield on the body part that we're actually X-raying, otherwise the X-rays wouldn't go through. It's also not typical for us to shield a patient over the age of 50, but you can certainly ask for a shield if you want one. We will still use shields on you even if you say you don't plan to have any kids, because the main purpose of shielding is actually to decrease the risk of cancer that radiation causes. We as techs always move far away and wear a lot of lead shielding during X-ray or CT exams, even though we might tell you that your exam is low risk radiation-wise, and that's because we're around radiation off and on for about 40 hours a week, not just briefly for a few times a year as a patient. Next, most hospitals and facilities have a policy against filming, recording, and photography. This is usually to protect patients, visitors, and employees' privacy. Also, filming, recording, and photographing in a hospital can overlap with certain US or state laws depending on where and what you're filming, recording, or photographing. So if you want to film an exam, such as an ultrasound, or take a photo of your X-ray, you'll want to ask first just to avoid any issues. Also, as techs, we will have access to very limited medical information about our patients, only what we need to know to do an exam because of privacy laws. For instance, we'll know that you're here for an abdomen pelvis CT with contrast for right lower quadrant pain, but almost nothing else. So we might ask you some questions that are probably in your chart, like if you have any allergies to anything or if you're taking a medication called metformin, but we're not really allowed to sift through your chart to find all of these answers, since it would have a lot of extra info that we don't need to know, and we're on a pretty strict need-to-know basis. Plus, it's not always guaranteed that your chart is up to date anyways. We also don't have access to update your chart. For my EDSers watching, we also probably won't know that you have EDS, and most rad techs haven't heard of it anyways. So if you want us to know something about your condition that might affect your exam, how we do it, or any special considerations, just let us know. On that same vein, if there's anything you think that us techs can do to make your exam go easier for you, please let us know. We're in this business because we like taking care of people. So if you need a warm blanket, a pillow for underneath your knees, someone to distract you during a needle stick, or even someone to hold your hand during an exam, just ask. If it's in our power and won't negatively affect your exam or anyone's safety, we'll do it. I hope you found this rather impromptu video interesting. I've been thinking about doing a few videos to explain and give a play-by-play of common radiology exams to help reduce the anxiety of having to have an unfamiliar exam done. If that's something that you're interested in and think would be helpful, please let me know. If you want to support the channel, just like, subscribe, and comment. Thank you for watching, and see you next time.